Hey everybody. So this is a two-part, the obesity and the nutrition lecture. On your obesity, your phentermine and your orlistat are your two drugs to focus on. I realized after I uploaded it, the phentermine, I uploaded a combination drug, so ignore the PDF for that. But I think I have a PDF for orlistat. I'm not sure how much information it gave you, so I'm going to give you what you need here with your phentermine. It is not an amphetamine, but it is related and acts in the body like an amphetamine. So anybody with a drug history, it is contraindicated, and you have to use caution because it can be addictive. It should be used for short periods. It is a Schedule 4, so they have to get a prescription, a controlled substance prescription for it. It should be only 1 month at a time. I have seen people on it for over a year. If somebody is on it for an extended period of time, their body has become very adjusted to it and they have to come off slowly, or they can have seizures and cardiac issues and other problems. It is a category X in pregnancy, and it is cautioned against breastfeeding because they do not know if it passes over, unsure about any dosing adjustments in a geriatric population, and it is for age 16 and older, not under age 16, so not for children. What else? It was part of a drug that was referred to as fen-phen because it was phentermine and I'm trying to remember the name of the other drug, fenflurin or something like that, and they called it fen-phen. Came off the market because of all these cardiac issues. So phentermine now is by itself. It's not the half that was causing the cardiac issues, but there are still cautions with phentermine when it comes to cardiac patients because of the history with the fen-phen. So they do say it is contraindicated in people with pulmonary hypertension or with hypertension, any type of ischemia, cardiovascular disease, including especially valvular disease, if they've had a bypass, heart failure, pulmonary hypertension, stroke, anything like that, using caution with renal impairment. What else? It's a once a day. It should be taken in the morning near breakfast time. Do not take it later in the day. Certainly do not double dosing if they miss a dose. Some potential side effects can be dry mouth, diarrhea, constipation, tremors, palpitations. Some more significant adverse effects can be confusion, irritability, depression, anxiety, even to the point of psychosis. So it is contraindicated in somebody with a history of psychosis, mental illness, contraindicated with drug interactions, cannot give with MAO inhibitors. Watch if people are on insulin or oral hypoglycemics because it can cause an increase or decrease in your glucose levels. Contraindicated with alcohol. Do not drink alcohol when taking phentermine. Do not take any type of stimulant. Also, if taken with bupropion, which is an antidepressant, it can increase the risk of seizures. I think I covered the main points for phentermine. Dosing 7, no it's not. Dosing is 15 to 37.5 milligrams per day, once a day dosing. Also, in renal impairment, decreased to 15 milligrams max dose. So now let's talk about orlistat. Xenocol is the prescription. Somebody said it in the class and I forgot it. There is the over-the-counter, which is half a dose of it. Can't think of it, but orlistat's the prescription. It blocks your absorption or lipase, called a lipase inhibitor. It keeps your fats from being broken down into the triglycerides that you absorb. It works in the stomach and the small intestines. So in decrease your fat absorption. So to help with weight loss. It is contraindicated in pregnancy, caution with breastfeeding because of the vitamin issue, contraindicated if they have a history of malabsorption, cholestasis, if they have a history of seizures. It is extreme caution because of vitamins, caution if they have a history of kidney stones because it can increase the risk, contraindicated if they have a history of pancreatitis, caution with if they have hypothyroid because it can block your absorption of your thyroid medications. Also can affect your vitamin K because it's a fat-soluble vitamin, so caution if they're on an anticoagulant such as Coumadin because of the vitamin K. Caution or decreased dose with hepatic or renal impairment. Some people who have other risk factors for hepatic failure have gone into hepatic failure when they're on orlistat. Also, some people have gone into a pancreatitis. Extreme caution if they are diabetic. It can decrease their glucose levels, so they may need to decrease their insulin or anti-hypoglycemic drugs while they're on the orlistat. Also blocks the absorption of cyclosporin or effectiveness of cyclosporin, so it's contraindicated in people who have had any kind of kidney transplant and they're on the cyclosporins. Thyroid medication, I think I said caution. If I say contraindicated, it's not contraindicated, but you need to make sure your thyroid medication, and if they're going to have it when they're on Coumadin, it needs to be at least 2 hours away from the dose of the orlistat. It is taken a maximum of 3 times a day. It is to be taken with their meals. If they skip a meal or they have a meal that has no fats, they are not to take the orlistat. And I messed up on the thyroid. It has to be 4 hours from the dose of your levothyroxine. I think 4 hours is probably best on any of it. It can block your absorption of vitamin D, your beta-carotenes, and your vitamin K. I think that's probably all you need to know when it comes to phentermine. That's good enough. Okay, so let's talk about nutrition, because nutrition is a significant factor when we get into seizures and some of these malabsorption disorders you've talked about. This just discusses some of your fat soluble, which your A, D, E, and K, your water soluble, your B vitamins, and your vitamin C. I've included in here which ones you need to be familiar with. Yes, Pierce talks about a little on page 1000. Karch has some of your over-the-counter vitamins and minerals in Appendix D. I found it myself a little confusing, so I made these slides for you to help you with some of the ones. So you're going to need to be familiar with the ones I cover in these slides. So your vitamin A or retinol deficiencies can cause night blindness. It's taking vitamin A is a category X in pregnancy. Of course, if there's a problem with your bile, appendix, gallbladder, cholecystitis, cholelithiasis, things like that, it will be contraindicated because you need your bile salts to absorb your vitamin A. It is a fat-soluble vitamin. It is given PO or IM. It is sensitive to light. The vitamin A itself, if they are on a supplement, so it has to be protected from light. And if they overdose on the vitamin A, a cirrhotic-like liver syndrome with CNS problems. Other things for your bile salts, also a problem cannot absorb it if they have malabsorption syndrome. Let's see, what else? Foods. I have noticed in doing the NCLEX reviews, there's lots of vitamins need to be familiar with their foods. So those that are at risk for vitamin A deficiency, I'm not going to go into those, but your foods, fish liver oil, egg yolk, your yellow vegetables, Orange vegetables such as carrots, sweet potatoes, yellows such as your squash, cantaloupe. Some of your others are your dried fruits, bell peppers, parsley, spinach, tomatoes, fortified milk. Vitamin A is stored in your liver. If a patient is on an anti-epileptic drug, they need an increased vitamin A. So, because the anti-epileptics decrease their stores of vitamin A in their liver, so you will encourage them with some of these foods. So if I ask you a question about what kind of foods you're encouraging or proper teaching, you'll name the foods that are high in vitamin A for somebody that's on an anti-epileptic drug. Vitamin D, I'm not going to read this line to you. Calcium, phosphorus, big thing with your vitamin D. I'm not going to go into the whole thing there. Foods, fatty fish such as tuna, sardines, mackerel, salmon, and other things are your beef liver, cheese, egg yolks are really high in your vitamin D. If you are on an anti-epileptic, it affects your calcium and vitamin D. They're very much at risk if they're on anti-epileptics for osteopenia, osteoporosis, bone fractures. So your calcium and vitamin D are imperative when they're on an anti-epileptic or foods that are high in your vitamin D. Also, your yogurt and milk products are high in vitamin A, D, and K. There's some fortified soy that's high with calcium. Orange juice, soy milk, fortified cereals, your dairy products. Okay, so your vitamin E, you need vitamin E to utilize your vitamin K. So if they are an anticoagulant, you want to have caution with them taking extra vitamin E or vitamin K. You also need your bile salts to absorb your vitamin K. Foods that are high in, your vitamin E. Foods high in vitamin E are wheat germs, sunflower seeds, almonds, and hazelnuts. I'm going to go into your vitamin K. It's for your blood clotting. It's rare to be deficient, but vitamin K synthesis eliminates bacterial. Vitamin K. Antibiotic therapy can mess up your vitamin K synthesis. Foods high. Kale, Brussels sprouts, broccoli, lettuce, spinach, asparagus, collard greens, turnip greens, obviously green leafy vegetables. Can be given IM or PO. Vitamin C, ascorbic acid. Here we come back to your anti-epileptic. If they have found, not necessarily only anti-epileptics, they have found that increasing your vitamin C level will increase your seizure threshold. So it is now encouraged to take a vitamin C supplement or eat foods high in vitamin C if you have epilepsy to increase your seizure threshold, decrease your risk for seizures. There has been no known overdose for vitamin C, and there is no proof that it boosts your immune system or antioxidants. Foods high in vitamin C that you would encourage for a person with seizures, especially on an anti-epileptic drug, would be guava, red peppers, kiwi, green peppers, oranges, strawberries, and papaya. Your thiamine, or B1, I would know it by both names. I've seen it in NCLEX questions either as thiamine or B1 or both. If I were to give it to you, I will give you both if I were to ask a question, but no either one. Again, anti-epileptics decrease your absorption or your levels of your thiamine, most of your B vitamins. So if they are on an anti-epileptic, they want to make sure they're getting foods high in thiamine or taking a B complex vitamin. Critical carbohydrate metabolism. I was thinking, with your seizures that you can have an increased metabolism. Anyway, foods. Its replacement is given oral or IM. They give it IM or IV If it's a significant deficiency, you might do it IM with a person with liver failure. But for these purposes, taking a B complex, a supplement PO, or getting foods high in B1 would be beef, liver, dried milk. I don't know why not regular milk, but dried milk, nuts, oats, oranges, pork, eggs, seeds, legumes, and yeast. It can be found in your some fortified foods like your pasta, rice, breads, cereal, and flour. Oh, can't get this to go to the next page. Go. Okay, your B2 or riboflavin, I am having trouble with my words. Note here, that taking a supplement of riboflavin can turn your urine yellow or orange. I don't remember if I said it on the previous one. With your phenytoin can turn your urine pink, brown, orange, and that's normal. In case I didn't, I just said it now. Okay, so supplement of riboflavin or B2 can turn the urine yellow or orange. And notice the deficiency is treated with a combination. That's why I always say B complex vitamins. Your anti-epileptic drugs does decrease your B2 or riboflavin level. So they either need to take the supplement or you need to encourage foods: beef liver, lamb, milk, yogurt, mushrooms, spinach, almonds, and sun-dried tomatoes. Niacin, or your B3. Notice your deficiencies are your 3Ds: diarrhea, dermatitis, diarrhea. Not to exceed 6 grams a day when you're taking a replacement. It's found in turkey breast, chicken breast, peanuts, mushrooms, liver, tuna, and green peas. That's all I'm going to say on that one. Oops, I skipped one. Your B6 or pyroxidine. Again, know both names. Your B6 is decreased when you're on an anti-epileptic. It significantly decreases your seizure threshold, putting you more at risk for seizures. So you definitely need then to take a pyridoxine B6 supplement. Keep them high in the foods that are high in B6. Most breakfast cereals are fortified with pyridoxine or B6. You will also find the B6 or pyridoxine in protein foods such as seafood, lean meats, poultry, eggs. It's found in beans, peas, nuts, seeds, soy, fish, beef, and turkey. Folate or folic acid, or your B9, which is what I mentioned with your neural tube defects or NTDs, for spina bifida in the infant because of pregnancy. Because your B9 or your folate is decreased when you're on an anti-epileptic. And you see here there's a drug interaction. It may decrease the effect of anti-seizure drugs. So you're better off taking foods that are high in the folate or the B9 or okay, so I'm looking at some of my notes here. Okay, so foods: green leafy vegetables, asparagus, broccoli, citrus fruits, beans, peas, lentils, avocado, okra, and Brussels sprouts are high. And so the B9 and the folate and the anti-epileptics counteract each other, so I would have them be taking the foods, because I did look and I could not find that the foods high in folate impaired, but the supplement may impair the effectiveness of anti-epileptics. Okay, so know those foods. Let's go to, I can never say the B12, cyanocobalamin. It's a word you should be familiar with because, again, we ordered that way, or the bottle will say that when you're going to do a B12 injection. If they have a pernicious anemia where they're lacking the intrinsic factor in their stomach, or if they've had gastrectomy or something like that, they will be on the B12 injections for life because they cannot absorb the B12 from the gut anymore. Again, you need increased B12 need if they are on an anti-epileptic. B12 deficiency can cause all kinds of numbness in the hands and feet or neuropathy. It can affect the mood, confusion, depression, delusions, even to the point of psychosis. If not treated effectively, rapidly enough, it can be irreparable nerve damage. Even when you get the level up, the damage may not be repaired. Foods high in B12 will be fish, meat, poultry, eggs, milk products, and fortified cereals. And that is the end of the nutrition lecture.